So a lot of people like to know how often they should get a bone marrow biopsy. And I've heard many of you say over the years that if things are changing, of course you should. But some patients feel like they should do it every year. What is your opinion about that? Naveen, do you want to start? And then, oh, Aaron or Aaron?
No, go ahead.
I think, yeah, I think this one, I think most of us agree on this. I think it's the first thing you said, right? So I think in PV for sure, it's just only when there's a status change. There are a couple of situations where people love to get the yearly bone marrow, right? So if you're on a clinical trial, that's one thing. I think sometimes for people's security or comfort, although beware, you do a random bone marrow, be prepared to see random results, right, Aaron? So sometimes the yearly bone marrow may not yield what you think it will. So I think for PV, I'm safe to say, no, please don't do a yearly bone marrow. Get one at diagnosis. The WHO does require that. I think it's important. Make sure you don't have myelofibrosis and make sure you don't have a concomitant multiple myeloma or a CLL, because MPNs do concomitantly have other things going on. But let's not get yearly bone marrows just to make people feel better. Let's reserve that for a status change. Aaron, what are your thoughts?
I completely agree. Yeah, definitely baseline. You want to get a bone marrow for a couple of different reasons. Establish what the bone marrow looks like right now in terms of fibrosis. 2, make sure there are no surprises like an MGUS or a CLL. And 3, get a chromosome. So a third of patients with polycythemia vera can have abnormal karyotype, and you want to know what the chromosomes are at that time. But after that, I think if patients, your blood counts don't come from the sky, right? They come from your bone marrow. And if your blood counts aren't changing, your symptoms aren't changing, your spleen is not changing, your disease is not changing. And doing bone marrows probably aren't going to change what you do necessarily, and could lead to odd things that then you have to explain off. When I remember distinctly as an intern, we would, you're so eager to order all these tests, and I was working with this doc and like, well, what are you going to do when this result happens? And you're like, I don't know. Like, don't ever order a test unless you're prepared to deal with the results. So I think that's a little truth in that, but really, I mean, your blood counts are a reflection of what's going on in the bone marrow. If they are stable, your bone marrow is going to be the same.